Today with your fertility specialist. On behalf of Alps Hospitals, we welcome you all to another interesting session with us today. Thank you for always staying glued to your screen. Thank you for always liking our posts. Thank you for sharing with your loved ones. We are so glad to have you guys, our dear viewers. As we get started right now, call up someone, share this link with someone. If you need to send data to someone, please, whatever it is you need to do to make sure that someone is connected to this session right now, please do that. We're talking about IVF today, and I'm your host for this session, Ruth Ogogo. And with me today, we have a guest with us in person of Dr. Deborah Olubi. Dr. Deborah, it's good to have you.
Thank you, Ruth. Always a pleasure to be here. And good afternoon, viewers.
So, for the sake of someone watching for the first time, a bit about Dr. Debbie. She's a family physician, she's an IVF specialist, and also a fertility specialist. Yeah, we're talking about IVF today, so it means that you have the best personnel talking about IVF with you today. So, please drop your questions, your thoughts, whatever it is, your opinions, drop them in the comment section. We would answer where necessary and would yes, we'll comment where we deem fit. But be sure that whatever your concerns are, they will be addressed in this session today. Once again, viewers, call up someone because this is really important. We're talking about IVF. A lot of, I mean, I know that now IVF is becoming really popular. So we hope that people are enlightened, but there are just still some people that might not even know about IVF. So you never really know who you might be helping by sharing this link. Dr. Deborah, we're talking about IVF today. IVF explained simply, or more like saying you demystify the mystery behind IVF today. So yeah, maybe before we start doing all the talks, what's really IVF? Because someone might just be wondering. A lot of acronyms could be IVF.
Yeah.
So what is IVF?
That's very true. So IVF simply means in vitro fertilization.
Okay.
So when we look at the words, in vitro means something outside the body.
Mm.
So the process is taking place outside the body, and
Yeah.
then fertilization is the process by which a sperm, fertilizes an egg so that it transforms into an embryo that can become a baby in future.
Mm.
When that pregnancy stays, it becomes a baby in future. So IVF is done outside the body. That's
Oh.
the eggs and the sperms are manipulated outside the body
Oh.
for this process to happen, and usually in a specialized lab that we call an IVF lab.
Okay.
So that's just IVF explained simply.
Oh, okay.
Yes.
So, so what would have actually happened naturally in a
In the
woman's
body,
body
happens
outside the body? So that's a simple way for us to understand. So there's nothing artificial about
No,
it,
there's
like
nothing
people would
artificial.
say.
Yes. The
A lot
sperm,
of
the eggs are not artificial. They're your
exactly.
natural sperms and eggs from your body, just that the process of bringing them together to fertilize is done outside your body.
Body. So it's not
Yes.
a taboo. It's not an abomination. It's not alo the way Igbo would
I've learned a new
say.
word.
well, yeah, so it's not any of this. So well, I know there's more that some might also just be watching. Okay, yes, they've said this. I don't think I need IVF. So maybe we should talk a bit about people that need IVF. So people who would know and they don't just assume that IVF is for some particular set of people or is for the elderly and not for the young and all
Yeah,
of
so there
that.
are
Yeah.
lots of reasons why people might need an IVF, especially, how you would might that you might need an IVF is, a married couple, you've been trying for years, for months to get pregnant. We usually use the age of the woman as the cutoff. For a woman that's 35 years or less, and you've tried for up to a year and pregnancy is not happening, that means there's likely a cause for why you're not getting pregnant. And then you go to see your doctor who will evaluate you, and then they could prescribe IVF as the
One of
way
the
out.
options.
Yes, but for a woman that is more older, greater than 35 years of age, after you've tried for about 6 months and spontaneous pregnancy is not happening, it's a good thing for you to want to know why.
Yeah.
Yes, and there are a lot of reasons for why IVF is done, and one of them is when there are issues with the fallopian tube.
Oh,
If both tubes are blocked or both tubes are damaged, blockage can happen from infections, pelvic infections in the past. Also, damage can happen from ectopic pregnancy. If a woman has ectopic pregnancy, most of the times the tubes are removed, and that
yes.
tube is the conduit. That's where the sperm and the egg, that's where fertilization happens
Happens.
spontaneously, happens in the
Mm.
tube. So if the tubes are no more present, there's no way for the egg and the sperm to meet. So for that kind of person or couple,
Yeah.
an IVF might be the only way to achieve conception,
Pregnancy.
pregnancy. So that's one of the reasons. Also, if you have male infertility, that's issues with the sperm, either low sperm count, issues with motility, that's the movement of the sperm,
Yeah.
or issues with the morphology, appearance, that's the sperm cells are abnormal. For
Mm.
that kind of man, IVF might be the way out, because with IVF, there's a procedure we can do called ICSI, intracytoplasmic sperm injection. In the
Okay.
body, in the spontaneous conception, what happens is that the sperm is able to swim, and then one sperm goes to enter into the egg, thereby fertilizing the egg.
Yeah.
But in this kind of situation where the sperms have issues, there's a process they can do in the lab that you can help the sperm using this ICSI that we talked about. So you
Okay.
try to pick one good sperm and inject it directly into the egg to cause fertilization to happen. So for male infertility, causes of male infertility, IVF might be the way out. Then for women that have disorders of ovulation, there's some women that do not ovulate, or they do
Mm.
not ovulate regularly. Usually women with polycystic ovary syndrome, and then also due to some other hormonal issues. For those kind of women, IVF might be the way out for
For
them.
them.
Other forms of fertility treatment can be tried, because IVF is just one form of fertility treatment. But
Treatment.
ultimately, if those do not work, IVF
Might be
might
the
be
way
what
for
will
them.
be, yes, what will be tried in those kind of women. Yes, and also for someone that's tried other forms of fertility treatment like ovulation induction, intrauterine insemination, and
Insemination.
it has not worked. So
For
IVF
them.
is logically the next thing that will counsel
Such
such people
people.
to try. Yes, and then there are other special situations where you might counsel clients for IVF. People that have genetic disorders that they do not want to pass on to their offspring, to their children. This issue of ASAS.
Yes.
Yes, and they're trying to avoid having a child with the sickle
Sickle
cell
cell.
disease.
Yeah.
IVF would be what would need to be done, not just IVF. IVF with pre-genetic and pre-implantation testings. That's, you do genetic testing of the embryos before you transfer one that does not have that abnormality.
Mm.
And then women that are advanced in age,
Yeah.
IVF might be the way forward for them too. And then people for other reasons too, people that want a particular gender, IVF can be done to select a particular gender.
Gender. Mhm.
Yes, for people that want to balance their families. Maybe they have a lot of boys, they want a girl, or they have a
Yeah.
lot of girls, they want a boy. So IVF can be done. So so you can see so many
Reasons
reasons why.
why
Yeah,
people.
people that have other medical issues, endometriosis that has damaged the ovaries, so
Hmm.
that means egg quality is
Quality
poor.
problem.
IVF might be the way
Way out.
forward. Yes, so a lot of reasons
People
why
that want people
IVF
that
can be
stay
done.
apart. Some people, some couple that maybe once
Good,
in a
yes,
while.
logistic reasons,
Mm.
especially in this our modern day society. The husband is in the US, the wife is in
Yes.
Nigeria. Those kind of issues,
Yes.
work, career challenges. That IVF might be the only way people
For them.
that are not around each other, because in the spontaneous conception to happen,
Yeah.
a woman and a man must meet after she has ovulated, and if the man is not in proximity, they are not together at
Yes.
that point,
Exactly.
IVF might be the way forward,
For
because
them.
with IVF you can have cryopreservation. The gametes can be collected
Preserved.
and preserved ahead
Mm.
of time. And then even in some special situation, people with cancer, and that they are preparing for treatment, either chemotherapy, radiation therapy, that could
Yes.
affect the gonads, they could freeze their gametes. Their
Yeah.
gametes can be saved or preserved. So
Mm.
when you want to use them, it must be through an IVF process
That's
that those gametes will
true.
be used.
Oh, that's
Yes. So you
true.
can see
Wow.
that IVF can be used in different peculiar situations.
Situations. So,
Yes.
viewers, after Dr. Debbie has listed all these reasons, I'm sure that you have realized that you might just be a candidate for IVF. Maybe maybe you felt it was for some people, or you're young and you feel it's for the elderly. If you're 20 and they see your tubes are
Or you are
blocked.
20. There's a situation we even call unexplained infertility. You've done
Mm,
all the tests, but we can't really find the reason why pregnancy is not happening, and you are still not getting pregnant. So IVF is the way
way
forward.
forward,
Yes.
exactly. So you
Yes.
don't just keep wasting time,
Time. Yes.
and then eventually you end up with the IVF eventually.
At the
So
end.
the earlier you
Yes.
do it, the better. Okay, so I know that, yes, after knowing that, after people have known that, okay, it's possible that I need an IVF. What's the way forward? How do they know? What's the whole process about? Like, what does
Okay.
it involve? Because
All right.
that's the next question people want to
And
know.
what does it
What does
involve?
it really
Yes.
involve? What does it entail? Yeah.
Yeah. So IVF, like you said, is a process. It's not a day. You can't just
Mm.
come today and say, "What an
Oh
IVF?" And
yes, I
IVF
actually
is
saw
on.
somebody that said she
Said,
just came
okay,
today. She said she thought they would do
do
the
the
epic.
IVF today. Yes. So
Yeah.
IVF is a process that takes weeks, between 3 to 4 weeks. And then, in IVF, we try to mimic what happens in the body spontaneously. What happens in
Mm.
a woman's normal menstrual cycle? What happens?
Cycle.
That
Mm.
in a woman's normal menstrual cycle, the aim is for her to have one mature egg at the end of the day that is
Yeah.
ovulated, for the sperm to now come and
It is.
fertilize. But in IVF, we try to modify this process so that our aim is to get more than one egg. Our aim is to get more than one egg. So this process usually involves injections. We
Mm.
take over the woman's system. There are different terminologies, but I won't want to go. So we take over the woman's system, then we give her injections to stimulate the ovaries to produce more than one egg. When these eggs are matured, the woman is taken to the theater and these eggs are retrieved. On that same day, her husband brings a semen sample. Then the sperm is used to fertilize the egg by the embryologist in the lab.
Mm.
This egg is allowed to develop. I mean, what we get when the egg is fertilized by the sperm, the embryo is incubated in the lab and allowed to develop for a few days before this embryo is then transferred back into the woman's uterus. So it's placed back on her endometrial lining. That's the inner part of the uterus, with the hope that implantation will happen and then pregnancy will happen.
Mm.
And then the
Wow.
pregnancy continues from there. But she's on injections, she's on different medications to support this whole process.
Okay, so do they get to live their normal life after IVF? Because I'm sure
Definitely.
they just want that. Maybe they feel it's gold they are carrying in their tummy
Yeah, we know
and
these
all
kind
that.
of pregnancies are
Precious
usually
living.
precious,
Mm.
but we encourage them to live their normal lives as much as possible. We just counsel them to avoid strenuous activities, but you live your normal life. Whatever activity, job or career you're doing, as far as it doesn't involve heavy lifting and a lot of stress, you go about your normal activities.
Mm. Okay, yes. So I know that you already answered that question as to how long
It
the
takes, yeah.
process. Are there possible things that people should know when they are preparing for IVF? Are there some evaluations that some of them would do in view of IVF preparation? Because somebody just comes, I want to do IVF.
Definitely,
So
definitely,
are there some
yes.
things that they would actually do? Are there some investigations that are required while preparing for an IVF?
Yes, definitely. There are lots of investigations required. So those investigations are usually tailored to what the complaints are. You take a history and the person comes, the history is taken, they are examined, and then
Yeah.
that will now lead you to know what investigations you want to do. But generally, for everybody, you want to screen for any infectious disease. You want to make sure their sugar levels are fine. You want to do a scan if, to look at the uterus, look at the endometrium, look at the ovaries. For a man, you want to do a seminal fluid analysis for a man. So you want to check the sperm to know what the quality of the sperm is like for a man. You also want to do some hormonal evaluations. We've talked about hormonal factors. So you want to do the female hormones, you want to evaluate them. You want to check their thyroid function. We know that the thyroid gland is very important in carrying a pregnancy to term. So a lot of evaluations are done. And then depending on what you find from some of the evaluations you do, if you see some abnormalities on the scan, maybe a submucous fibroid, you see a polyps, you might counsel this woman that she needs to have a hysteroscopy. Some people, you do a scan, you see fibroids all over the place. The uterus is distorted, the cavity is distorted. That kind of woman, for IVF to even have a chance of succeeding, she needs to have a fibroid surgery first. So
Hmm.
what the client is told to do will be tailored to what is found from the evaluations Some people that have hormonal abnormalities, sometimes we place them on drugs to try to correct, these hormonal imbalances.
Yeah.
For some of them, we could even say they have a procedure. For someone that has polycystic ovaries, she could even be counseled to have a laparoscopic ovarian drilling, all in the aim to improve, the quality of eggs you get from her at the end of the day. Yeah. So whatever is done is tailored to what the client presents with. Is what will tailor the extent to which you evaluate and the extent to which you ask them to have some procedures done before the IVF itself.
Okay, so yeah, before we continue, a question just came in from Usman. Oh no, sorry, not Usman. Umu asking with how about people that because I know you mentioned that people that have male infertility issues. So the
Yes.
person is asking, what are people that have azoospermia? What's
Okay.
their chance of succeeding with IVF, or what way do they achieve pregnancy during an IVF?
Okay.
Yeah.
So for someone that has azoospermia means you examine the semen and you do not find any sperm cells. Yes. So we want to know whether it's a problem of production, spermatogenesis, or a problem of obstruction in the passage that brings out the sperm to the
Yeah.
exterior. So whether it's obstructive. So we do some further testing for this kind of people.
Okay.
So the further testing will tell us whether the person is actually producing
Producing
sperm,
sperm.
or there's an obstruction along the pathway. Yeah. So if it's the cause of the azoospermia is that there's no sperm being produced. So unfortunately, there's little to nothing that can be done for this. We could try something we call testicular rejuvenation. Testicular rejuvenation is an attempt, PRP, platelet-rich plasma, is injected into the testis to stimulate the testis to start producing sperm again. Depending on the degree of the azoospermia, if it's total azoospermia, you do a scan that tells you about what the morphology, the histology, the structural damage, if there are structural damages,
Testis.
yes, in the testis, that would determine if this could work. And then to also determine the number of times the person might need to have this procedure, because you could have it up to 3 times. So it's just an attempt to,
Stimulate
the testis to start producing sperm again. So it might work, it might not work, yes. So, but if it's an obstructive problem, that's an obstruction along the duct to bring the semen out, then a procedure we call PISA or PISA, that's the person is taken to the theater and the
Yes.
sperm is aspirated directly from the testis, can be done to retrieve sperm. Yeah,
Okay.
so it depends on the kind of azoospermia we have.
Okay, so hope this answers your question, Umu, because I know that's a lot of concern with respect to IVF, and viewers. This is also a reminder that we are live on all platforms. So please drop your questions, whatever it is that is bothering you, whatever it is whatever it is that really seems like issues that you've not been able to address for so long. This is the right time to ask these questions, because Dr. Deborah, like I mentioned, she's an IVF specialist, so this is more like her field. You can ask all your questions and be sure to get the right answer, and the right options we prefer to you that would actually help to achieve pregnancy, whatever the issues might be that you're dealing with. So, well, yes, that was a question that came in, and
Yeah,
for that.
and then just to balance it, after if you've done this, sometimes you do the testicular rejuvenation. Is that not able to help? The other option might be for the couple to consent to using donor
Donor
sperm.
sperm.
Yes.
Okay. So that's another option. So
Yeah.
that's the chance. Yes, as much as it might not be genetically connected, but if your wife gets to carry the pregnancy,
Yeah.
I mean, it's still, you don't need to tell anybody that it's donor sperm you're opting
Yeah.
for. It's something between you as a couple, and that's if you. Some couple will say, "I don't want this partner or this partner." Well, that's your decision to make. Whichever way, whatever you want, you can guarantee that it's kept confidential, and you could achieve pregnancy hopefully with the option that you take in. And then, yeah, does age really matter? Because I know we've talked about that. Some people would want that I'm too old. And don't you think I've gone past IVF? Or some will say I'm too young, even though I know you've talked about
We've talked
age
about
that
women with
they are not too
advanced.
young for it and
Yes.
all of that. Yeah.
Yes.
So
So age is a factor in
yes, in
IVF.
IVF, is it something you people consider when you're doing IVF? Because you
Yes,
can have some
definitely.
people that's really
Yes.
elderly and they'll say, okay, can I come in for IVF? But there's some things you consider for
Yes,
age.
definitely age is very important because age affects the egg.
Mm,
Like we said, a woman from about 35 years of age, the egg quality, the number of eggs in the ovary starts declining. So age will affect the kind of IVF we do. Is this client going to be able to use her own eggs, or will she have to use donor eggs? So age will come into
into
the
play.
picture in that sense. And then age overall also
Yeah,
is in looking at, is this person fit to even carry a
yeah,
pregnancy?
exactly.
A lot of evaluations are also done to determine if this client is fit, to
Carry.
carry a pregnancy.
So it's a matter of whether you are fit.
Yes.
Yeah. Okay. So hope that also hope that has been able to clarify your doubts with respect to age. Because yeah, I know that some people would wonder, am I not too old for an IVF? It just depends. First of all, it depends on the age,
Yeah.
and it depends on whether you're fit. So if you're someone wondering, maybe you could still further
They
book a
need to come for
consultation.
come
Yes,
for an
book a
evaluation. Yeah.
consultation and have a proper and thorough evaluation.
Evaluation.
So you're sure whether for you age is a problem or
Or
not a
not.
problem or just a number for you. So yeah, okay. And I'm sure that there are also people that are wondering about IVF. Some people will say the pains that come, is it painful? Is it a painful procedure? All those talks that come, those injections, don't they have impact on me in the future? All those talks that come
Okay.
with IVF. Maybe I feel you should talk a bit about some of the wrong notion that people have with respect to IVF. Some people feel, okay, if I have IVF, it means that I would have to do IVF all through, like all my pregnancies will have to be IVF.
IVF.
Yes, I'm sure with your experience, you've seen some people. So, and I mean, just say something
Okay, so you
about
talked
it.
about pain first. Pain is subjective. What might be painful for me might not be painful. We all have different
Yes, true.
pain threshold. Yes,
Yes,
IVF involves injection. So injection is a needle. So those some of the needles are quite tiny,
yeah.
but definitely there might be some pain. But how people perceive it, is different for everybody.
Mm,
But we do what we can do to reduce whatever discomfort and pain to the barest minimum,
complete. Yeah.
especially for procedures like egg retrieval. They are giving adequate
Mm,
analgesia, sometimes even sedation, even sometimes we give anesthesia. For clients that have raised, they have told us,
some
oh, I would
concern
want to have anesthesia for this, my pain threshold
and
is
all
so
that.
low, and all
Yes,
that. And even us as healthcare personnel, when we evaluate a client, we might know that this kind of
I
client will
need a
need this
higher
kind
form
of.
of
Exactly. So
anesthesia.
that is done. And then in terms of yes, there are lots of myths or wrong misconceptions about IVF.
Yeah,
People feel it's artificial, it's not natural. IVF is very natural.
natural.
Science has not advanced to the stage that we can produce sperm or
Exactly.
eggs. So it's
Mm,
still natural what God has placed in your bodies. That's why we tell clients sometimes when you counsel clients, especially more advanced age women, about the chances of success with their own eggs. They it seems as if you're looking down
and
on them when you tell them the reality. They don't
yes,
sometimes a lot of them don't like hearing those hearing that. But we tell them it's what your body produces that we
yes,
work with.
it's true.
And nature cannot go against itself.
Yes,
From the
yes,
evaluations
true.
we've done, this is what we've seen. Your
Mm,
ovarian reserve is low. This is what we're likely going to get. So IVF is natural, it's not artificial. People wonder whether the babies are abnormal,
normal,
yeah, or
exactly. Mm,
normal. They
yes,
are normal human beings in every
exactly.
if every respect. So there's nothing unnatural about IVF. The only thing is that this fertilization is done outside your body. It's still your eggs, it's still your sperm, just that they are manipulated outside the body, and then the embryos that are generated, they are still transferred back to you. So I think those are some of the
Miss
misconception I know. I
understanding.
know there are lots of other things, but I think those are some of the common ones, the
Well,
fears
you
people have about IVF. And IVF, yes, even after an IVF, you can, depending on the cause of the infertility
infertility.
or the reason for why an IVF is done, some
Mm,
women can go on to have spontaneous pregnancies. I've seen that a lot. Someone had an
mm,
IVF, goes on to have spontaneous
it's
pregnancies.
pregnancy.
Yes, because somehow the fertility treatment, especially when if it was some hormonal issues that were
Yeah,
leading to anovulation, that's not ovulating.
ovulating. Mm,
Some of those things get corrected with IVF, and then you see them having spontaneous pregnancies.
consumption.
Yes, and IVF does not have any long term side
Side
effects.
effects.
Yes, at that immediate, yes, you're taking injections. Some of the hormonal medications have some side effects, nausea, mood changes, but as soon as you stop the injections, oh, your body goes back,
To normal.
yes, to
You
the
know, it
way.
just reminded me of someone that had a failed IVF. So
Yes.
she was just saying, what can she do? She has gained weight so much.
Okay,
What
weight
what can
gain,
she
yeah,
do?
from the
She's
hormonal
feeling
med.
somehow. How and you're just like, so I mean, thank God that you've talked about it now, and I'm sure that a lot of people would have the understanding of this. These are common things that are common with hormones,
No,
whether it's
yes,
IVF or
or
not.
maybe it's family planning,
Which
medications and
yeah,
all that. Yes, hormones, and you can't predict who will have what side effect because they affect people
yes,
differently. Some
yes,
people take
it's
the hormone,
true.
they say they add weight. Some other people they remain the same. Some
Mm.
will even tell you they're losing weight. So everybody, what
Yes,
everybody experiences
exactly.
is different. But whatever you experience, the healthcare personnel are there. You can always ask us questions, and we will let you know. Oh, this is normal. This will go away. Don't worry. So your fears are allayed. Any anxieties you have, they are taken care of.
And so so dear viewers, don't make anyone make you feel less of yourself because you are doing an IVF. It's not a bad thing to do. Like I said earlier on, it's not an abomination. It's not wrong for you to. It's more like
It's
taking
a
a step
treatment.
to
It's
achieve your
treatment.
your fertility goals or
Yeah.
achieve your pregnancy goals.
Yeah.
And instead of just staying and remain childless and waiting for as long as you can wait, why not get it as quick as you can once you know there's a way out? So do not allow anybody to bring any cheap talk to you, making you feel so bad that you're going for an IVF. I know that yes, you don't have to put a loudspeaker in your mouth and announce to the world that you're doing an IVF. But should it be that people around you get to know, please do not feel bad about it. Be proud of it. It shows that your children are you took out time to actually get these
Yeah, you're,
children.
you're
It's not
taking
just a random conception. It's something that you took out time. It was you are intentional
deliberate.
about it.
Yeah.
Yes, you're deliberate about it. So please do not feel bad. That's something that we feel you should also take home today. It's not a bad thing. It's not a taboo. It's not an abomination. Yeah, I think another thing
And
because
yes, and to add to that, yes, IVF, what is a treatment option. So the way people take treatment for different medical condition, this is the treatment that was prescribed for you. So there's nothing
yeah.
to feel bad about. Mm.
Okay, so as we wrap up, this is a final question. This is a question that people ask a lot. Does IVF feel? Because some people just feel once they come for IVF, it's
Yeah.
supposed to be automatic. It's
and
supposed to
and that's one
succeed.
of the misconceptions people have about IVF, that
Mm,
IVF always succeed. Yes, IVF is very helpful. IVF has helped to bring a solution to issues of infertility, but IVF does not always succeed. Yeah,
mm,
in fact, studies have shown that IVF succeeds more with the more attempts you have. So more people succeed on a second attempt than
mm,
on a first attempt. More people will even succeed on a third attempt than on a second or first attempt.
mm.
So IVF doesn't always succeed. But in our center, what makes us get the kind of successes we see is because of the proper evaluation and counseling we give our clients. And if a lot of these clients are receptive to the counsel they give, they automatically increase their chances of achieving success.
Yeah, so you get the best of counsel at Alps. You get very high expertise. I mean, top notch expertise at Alps, and that's why yes, we are grateful. As much as we are grateful for the successes, we also pride ourselves in the successes because of high expertise, experience, evaluations, and all that are done. Okay, so we have a question coming from Ruth. My namesake. Hi, Ruth. So she said her question is about high prolactin
Okay.
hormones that after many tests the results showed normal and even low, but she's still having breast discharge. That she has done evaluation, they said prolactin is normal, so she's just wondering. She said it's about high prolactin hormones. After many tests the results showed normal and even low, but breast is still bringing out discharge. Well, I think she's concerned. Well,
Why?
we don't
Yeah,
know.
so if the prolactin is normal and it has been corrected and is normal, so another reason should be looked for why she's still having breast
Breast
discharge. So
discharge.
it's not due to the high prolactin any
Prolactin.
longer. Yes,
Mm.
so that will not need to be corrected.
Okay, so for Ruth, I hope that answers your question. It means you might need more
Further
further
evaluation, yes.
evaluation. So please do seek more investigation from the right personnel, and let's also be sure that when you did your investigation, they
The
also
results
know
are
what
accurate. That's
exactly
true.
they know
Yes.
what they are doing. Be sure that where you did investigation is a good place. Another question. Well, Facebook. Hi, Facebook viewers. You are engaging us so well. Thank you. Viewers on other platforms, we are still anticipating your questions. Please keep your questions coming. So we have Alta. I hope I pronounced the name right. So, what are the chances for someone with low sperm count? I know Dr. Debbie has talked about that, but just
Yes.
to answer him, maybe he joined
All
or
right.
she
So it
joined in
depends on the
between.
degree of the low sperm count. And it's not just the sperm count that is important. We're also
Mm,
looking at the morphology, how normal the sperm cells are, also the motility. And there are further testings we do, like the DNA, sperm DNA fragmentation index. So all this helps us to know how healthy the sperm is.
mm,
So it's when you put all this together that you can now talk about chances of a pregnancy ensuing from this sperm.
mm.
So yes, the person needs to come to be properly evaluated. So we don't just stop at the seminal fluid analysis. There are other testings we do. Hormonal profile for the man. We do a DNA fragmentation index. We do a scrotal scan. All this will help us to have an overall picture of how healthy whatever sperm the person has
Yes.
is.
Okay.
Yeah.
So viewers, I hope for Alta, I hope that answers your question. So it depends on that, like Dr. Debbie has said. I mean, there couldn't have been a better way to answer that question. Well, yeah, someone is talking about said talk about the cost, please, doctor. Well, I don't, of course I'm sure Dr. Debbie can give you a range, but I know that IVF is not cheap anywhere in the world.
Yeah,
Yeah.
so I know a lot of factors goes into the cost. The kind of IVF you're doing, the kind of protocol you need to have, what is involved in the IVF. So cost might not be something we can discuss on this platform.
But
You would need
treatment
to
is in
come.
millions, and it's not something that you can easily just you have to prepare for it. Yeah.
Yes, you
You
need
could
to
also
prepare
book
for
an
it.
online consultation. Stella, yeah, you could book an online consultation, or you could send a message via a private chat, and you definitely get a response to that. But the cost here, like I mentioned, is not cheap anywhere in the world. I mean, you get that for thousands of dollars, even in the Western world and all. So it's not cheap anywhere. But if you want to get a precise cost, then you could have a private chat with any of on any of our social media handles, and you will definitely get a response with respect to that. So as we talk about this, what's your counsel to people generally with respect to IVF?
Okay,
What's your
so
counsel to people generally?
yeah, so people should, when people are not informed about something, there's always a lot of fear, a lot
Yeah.
of mystery. So thank God for a platform like this so
Yeah.
that we demystify IVF. Like I said, IVF is just a treatment, it's a form of fertility treatment. There's no mystery or anything, hidden about it. You know, just get information. You could even get reviews from people that have had IVF before. The more information you have, the more informed you are, the more you're open to it. Like you said,
Yes.
it's nothing to be ashamed of. You can always come in for a consultation. Let's evaluate, and then we talk you through the process. Nothing is hidden about it.
Hmm.
Yeah. And if you're told, if you've been trying for some time, please don't keep trying. Like we always say, a woman's clock is ticking. The
Yeah.
earlier you take a decisive step about it, the better for you. Yeah, and the earliest time is today. Today that you're hearing us, this is
Yeah.
the
There
earliest
couldn't
time to do
the
something
time is
about it.
now.
Yes, time is now.
There couldn't have been there wouldn't be a better time than
And
now.
now,
So please make
yes.
the right choice now. Yes, I also we would wrap up on this note, but what's your counsel to someone that might have actually had an IVF failure and is feeling really down, discouraged, not wanting to try again, just feels like if IVF fails, that means that's all. It means it
Yeah,
can't
that's why
happen
it's
again.
important people come into having an IVF treatment with realistic expectations.
Hmm.
Like we've said today, IVF is not always successful. There are lots of
Yeah.
factors that can make an IVF fail. Don't blame yourself. If you remain in the blame game, you're not going to move forward. Don't
Yeah.
blame yourself. It's one of those things. And the fact that it has failed now doesn't mean it will fail again. See your
Hmm.
fertility specialist. Go back to the drawing table.
Yeah.
The previous treatment or previous failure can even be reviewed. That can shed light on the new way to go about your treatment. There's
Yes.
always something that can be done. Please do
Hmm.
not lose heart, don't lose courage. There's always something that
So
can be
can be
done.
done.
And I know that your day of joy, it's coming soon.
Amen. We hope so too. We
Yeah.
pray that for someone that might be going through hard times, maybe from a failure in the past, do not give up. It's not the end. Do not say because it has failed the first time. We've seen people that have failed up to 5 times, a sixth time it worked, or even 7 times, the eighth time it worked. And I know sometimes we say, okay, yeah, the monies are not easy to come by and all, but sometimes when you put your mind to doing something, somehow you just find yourself gathering these resources and you eventually achieve what it is you want to achieve. So do not give up. Keep your hopes alive, and we hope that someday, not so long from now, not far from now, you'll be able to achieve your dreams of having your baby or your babies, hopefully by the mercies of God. It's been amazing having you, our dear viewers. Thank you so much, Dr. Deborah, for this insightful session.
You're
We
welcome.
definitely had a good time, and IVF couldn't have been as simplified as you've actually addressed it today. I know that a lot of viewers have actually had reasons, and I'm sure a lot of people are changing their minds now and are now rushing to come for IVF. Well, that's if IVF is actually preferred for you, and if that's the counsel for you. Thank you, viewers, for engaging us, for staying glued to us. Please always stay tuned for our notifications on our various handles. And please do not forget to like, do not forget to share, do not forget to watch when we have videos for you. Thank you once again. Have a lovely weekend. Bye.